My name is Dr. Nafisa Adodahiru from NMSL KADUNA. Today, we'll be looking at sickle cell disease. My outline will start from introduction, epidemiology, down to conclusion. What is sickle cell disease? Sickle cell disease is a group of conditions in which red blood cells are not shaped as they should be. Red blood cells normally look like round discs, but in sickle cell disease, they are shaped like sickle or crescent moons instead. The highest frequency of sickle cell disease is found in the tropical regions, particularly Africa, India, and Middle East. It causes 50 to 90% mortality in under 5 children, a total of about 150,000 births annually in Nigeria. Nigeria accounts for 33% of the total burden of the disease. Sickle cell syndromes. The main sickle cell syndromes include sickle cell trait, HbAs or AS. They are carriers and may have no symptoms or reduced symptoms of the disorder. Sickle cell anemia, HbSS or SS, the most severe form of the disorder. Hemoglobin SC, second most common type of sickle cell disease. Hemoglobin S, beta thalassemia. This is a mild form of sickle cell disorder. The genetics. It is an autosomal recessive blood disease. It is not contagious, you can't catch it. It's inherited from your parents. The person that receives a defective gene from both parents will develop sickle cell disease. The person who receives only one defective gene from either one of his parents will develop sickle cell traits. HbAs and usually does not show severe symptoms like people with sickle cell anemia. Pathophysiology. Hemoglobin S is a structurally defective hemoglobin. With low oxygen levels, red blood cells undergo changes which cause the cells to become stiff and sticky. The cells get stuck together and block small or large blood vessels, preventing blood from moving as it should, which leads to pain and organ damage. The cells also hemolyze, which means they break down faster than normal red blood cells, lasting 10 to 20 days from 120 days, which leads to a condition called anemia. The most common symptoms of sickle cell disease is anemia, which presents with fatigue, irritability, and shortness of breath. Others include abdominal pain, bone pain, fever, hand-foot syndrome due to blockage of the blood vessels in the hands and feet, a yellowish discoloration of the skin and eyes called jaundice. Diagnosis is by newborn screening, solubility test, hemoglobin electrophoresis, sickle test. Sickle cell disease also might be diagnosed before a baby is born with a test on the amniotic fluid or with sample of the tissue from the placenta. Other investigations include a complete blood count, iron studies, chest X-ray in acute chest syndrome, transcranial Doppler ultrasound. Factors that precipitate crisis include infections, low oxygen tension, concomitant medical conditions like diabetes mellitus, dehydration, extreme physical exercises, psychological stress, cold weather, pregnancy, alcohol, among others. Treatments for sickle cell include pain management with NSAID and opioids, intravenous or oral fluids, malaria chemoprophylaxis, immunization, supplements like folic acid, antibiotics for infections, hydroxyurea, blood transfusion for severe anemia, or treatment to prevent complications. Stem cell transplant, also called bone marrow transplant. Complications of sickle cell disease include stroke, leg ulcer, blindness, chronic renal failure, acute chest syndrome, cholelithiasis of gallstones, spontaneous abortion, and septicemia. Sickle cell disease can be prevented by genetic counseling, pre-implantation genetic diagnosis, prenatal testing with amniocentesis, and chorionic villus sampling. Sickling genotype compatibility. AA is okay. AAAS is also okay. AAAC is okay. The only option for SS is AA, and the only option for CC is AA. The others are not advisable. In conclusion, sickle cell disease is a hereditary non-infective disorder. Adequate genotyping and/or emergency hospital practice helps forestall against crisis in life. NMSL KADUNA advises that everyone know their genotype. Thank you.